Hi, welcome back to Mike's Diabetes World. Today, we're going to take a look at the blood sugar. It's 20.9. I've taken a correction dose of 15 minutes, and hopefully by mid afternoon, I'll be back down. But, people, I get this question from other diabetics: why can't I get good control? Well, there could be many different answers. Are you doing, sorry, I gotta take my wristband off. Are you doing all that you can? Are you doing it correctly? Have you been trained in how to take care of yourself? People just think, oh, magically, my body, I'll take the insulin, I'll test first thing in the morning, and then I will have the perfect blood sugars all day, all night, and everything will be fine. No, maybe you probably see better blood sugars, but are you going to see everything fall right into line? First of all, when you decide you're going to take control, there are still so many other variables. You've been eating food that's probably had a whole bunch of hidden sugars. And it sometimes does take a bit to get those worked out of your system. So people who say, well, yeah, I tried that for a day and it just didn't really seem to work. Well, no one's going to get perfect fine tuning. And if you've been in the hospital like myself to get recalibrated or get put back into line, you will know that doctors don't get it on the first strike. In fact, when they let you go, they usually let you go with a little bit higher blood sugars because they know that fine tuning will happen when you're at home. So when you get home, there's some rules you need to work on. One, and I've said this before almost every step, go see your doctor. Set out guidelines of what he thinks your correct dose is. Don't, excuse me, don't sit there and say, well, I think I should take this much insulin and then this much insulin for carbs. There actually is an equation that your doctors and your diabetic nurses have to follow. Let me get a drink here, sorry. There, that's better. So just have you coming up with imaginary numbers to start off with could have you end up in the emergency room with a low blood sugar. Once you have that information, you're pretty well set to go. When you're watching your blood sugars, don't overcompensate, meaning don't do a blood sugar, see you're high, take insulin. An hour later, take another blood sugar, see that you're high, take more insulin. Because what that is that stacking. And that is not going to help you. Now, it was later determined the reason why I couldn't really get tight control was because I'm a brittle diabetic or a labile diabetic. I'm sure I'll get used to using labile and they'll change the term again. But my blood sugars don't really follow a rhyme or reason. I can be super high and then head straight down very quickly. I take longer. If they find that I'm out of control and they say, well, we're going to keep you in the hospital for a couple of days just to get you back into line, I usually know it's going to be a bit longer. My worst time was it 2014 or 2013? I was in the hospital for 9 months because they couldn't control my blood sugars. So, just because you're having a hard time, first of all, don't just assume, oh, it's because I'm a brittle diabetic. That has to be it. You don't want to be a brittle diabetic. People tend to try to use those as excuses. And diabetes should never be used as an excuse. But it's always the easier way. Yeah, it's always easier. I, I don't really have to worry about I could always just blame it on my brittle diabetes. It's an easy escape. But doctors will want to run some tests to see, are you actually brittle? Or are you not really watching yourself? Diabetes is not an easy disease. The 2% of all diabetics who are type 1 realize this. And the 2% that are truly brittle diabetics after that tend to know this. It is not the greatest thing. I would just love to be a normal diabetic. There are days I have great blood sugars. Then there's days like yesterday where I spent more time at peaks than I did. You have to follow diet if you're going to want tight control for a T1D. You're going to have to do medication, diet, and make sure you know how to count carbs. People tend to think, oh, well, I went to a dietitian once before. I don't need to go again. Well, things change. There's stuff, right, you were taught in school that you probably forgot. Let me say, if your kids ever brought you math problems to do, fractions, how many of us could do friggin' fractions today? So you need to sit down with a dietitian, sit down with your doctor, sit down with your diabetic nurse, say, hey, I really want to do this tight control thing. How do I go about doing it? And it's just not the one visit. You'll have to do follow-ups. Some doctors will say, okay, come see me in a year. Others will say 6 months. You will also have to get blood work done. You'll have to get a hemoglobin A1C. You'll have some I've heard now are tracking their time in range. So why can't you get control? Well, there could be a few variables set in there. Remember, don't give up. Keep working at it. You're worth it. Have a great day. Talk to you later. Bye now.